While the onset of monsoons brings a big respite to all of us from the scorching summers, for a pregnant woman this seemingly favorable season may not seem so. However, I am Dr. Rujul Jhaveri. I would provide you all pregnant women with some tips which will make this monsoon, these 3 months, as easy as it can be for even you. So, starting with some basic tips, I would like to start with food and diet. The need for a nutritious, balanced diet cannot be overemphasized, irrespective of the trimester of pregnancy or the season. You need to include freshly cooked meals, avoid pre-cooked or raw vegetables, raw meats. Hygienically prepared meals are the most important. No matter how tasty they may seem, no matter how heavy or severe the cravings may be, street food, junk food has to be strictly avoided. Fluid intake has to be at least about 2 to 3 liters of water. This fluid can be in the form of water, juices, fresh juices, or even pre-packaged juices, but ensure that they are hygienically prepared and packed. Coming to the next aspect would be personal health. I prefer to divide this topic into 3 parts, which would be personal hygiene, clothing and footwear. So personal hygiene, while we all emphasize on personal cleanliness, I always tell my patients the important words are clean and dry. Dry is equally important because humidity or moisture is one of the major factors which leads to bacterial and fungal infections in pregnancy, more so in the monsoons because one, damp clothes and the overall moisture and humidity in the air. Coming to clothing, yes, comfortable cotton clothing in these summers and even the monsoon is important. Again, avoid damp clothes. Let your clothing be comfortable for ease of movement. Footwear, avoid heels, especially if your work involves a lot of walking. Let it be comfortable footwear, although covered so as to protect you from the heavy rains. And next important topic that I would like to cover for the monsoon for all pregnant women is travel during monsoon. While it may seem such a wonderful idea to travel to far off places, hill stations, etc., yes, long distance traveling in pregnancy is now allowed, but of course with the advice of your gynecologists. However, local travel, considering the condition of our roads, should be avoided until and unless necessary. If at all, if your work or your job requires you to travel daily, please ensure that you are avoiding any kind of speeding or jerky rides. While long distance train travel may be considered relatively safe during pregnancy and even the monsoon, however in cases of heavy rains and heavy alerts, they may be unreliable, the schedules may be haywire, hence you may avoid them. However, if you need to undertake such long journeys, ensure your diet and your water intake is adequate and you should be sorted. Thank you.